review. I have a new story to tell people when they say they can't do something. We went over the Apollo 13 disaster. How they were in a major crisis. So those dudes had an explosion along the command module. So they had the lunar module, command module, right? So when the command module had a tank explode, all three of them had to go into the lunar module, but it only had enough CO2 scrubbing. The CO2 they expire for 2 guys. So they had to figure out how to make something homemade to increase the CO2 scrubbing, or else they would all die of asphyxiation. On top of that, it was cold. There's no heat in the lunar module. They're using your spacesuits. On top of that, nobody's ever tried to take the command module and re-enter the Earth with it. Wasn't made to do that.
They did it?
And then I tell people, and you can't get this done in 6 days? You telling me with a 3 kilobyte computer, no phone, no cell phones that we have now, no tower. They figured it out, and they brought 3 guys home: Jim Lovell, Jimmy Swaggart, and Fred Haynes. And you can't figure out your crisis? I'm like, try again. So, once you hear that, you're like, ooh. I tell people that all the time. People are always like, hey, you missed these payments here. I'm like, how much you want to bet today? You want to bet $100? And they're like, no, I don't bet that. I said, well, and your stuff is wrong. I said, you know how I'm right? Because I check these every day. Do you check them every day? No. I said, could there be a possibility that you're wrong? Yes. And guess what? They were wrong. That's what I do all day. Go after vendors. Think they're right, or think we missed the payment. I like those stories. It lets you know. And if they brought 3 guys home in a command module that was never made to re-enter the Earth, and they lived in a lunar module that was never made for more than 2 people, they brought all 3 of them home alive. So you could probably do what you said you couldn't do.
And no,
You think technology cares? I mean, I don't care that they don't care. I'm just going to keep preaching until I'm blue in the face. You can't do it or you won't do it.
Going live.
You can't do it or you won't do it.
or you won't do it.
100. I think most people won't do it. There's a lot of cans in this world. Chernobyl. Remember Chernobyl? Yeah. Leaking everywhere.
Huh? I haven't tried.
Go ahead. Go.
Hello. We are on our 3rd case. Our patient here in the OR is, we are doing a gynecomastia today, so we're removing some excess breast tissue on our male patient's
Get the VC blinking button there.
pecs. We're just getting started here, so what that looks like is Dr. J is going to go in with a liposuction tool around.
No, it's not even registering that these petals, they may have to be
where the markings,
John, I'll tell you.
where Dr. J made the markings.
We'll be done here
We're
in a
going
little bit.
to go in and do some lipo to remove that excess breast
So
tissue.
Chernobyl had exploded, right?
If y'all have any questions, go ahead and leave those down below. We're also live on YouTube for this one, so if you're interested in seeing what this procedure looks like, you can find us at Dr. Jeneby Plastic Surgery. This is our last live of the day. Earlier this morning, we went live
Oh, you got it. What happened?
for a rhinoplasty.
Which is like an expert control.
That was our first case. For our second case, they were a lipo 360. We did some fat grafting. We did lipo to our patient's size as well. But for this patient,
You Xbox the other one?
You were just doing it.
Get closer. There you you had it.
Hey there, Casey, on our YouTube. We go live here on YouTube to show our
You don't
procedures.
do it.
Of course, the patient consents to all of that. We don't
Sit there.
just show random people's surgeries if they don't want to be shown, but it's usually for educational purposes or to inform people that are interested in getting procedures done. So that's why we're live. We're doing a gynecomastia today. Usually our patient's family or friends will want to join us over here and see what's happening in the OR. And even some of our patients will like to come back and rewatch these surgeries themselves. And also our patients that are curious about certain procedures, they will join us on our YouTube as well to watch and see if they're interested in some procedures, what they can expect. So that is why they're Casey on our YouTube. Again, for those of you joining us on TikTok and Instagram, we are on our third case of the day. We are doing a gynecomastia on our male patient. So again, that is just removing some of like what we refer to as man boobs. We see these pretty fairly often, I would say, when it comes to like male procedures. And so we are so we're also showing this on YouTube. Yeah, Casey, of course. That's definitely something that we would never do unless we got all the consents from our patient, all the consents regarding what they're comfortable with showing. And I think a misconception a lot of people have when we go live is that we expose their identity, we expose like their name, their face, and obviously for this procedure, it's just showing where we're doing the procedure. It's not showing their face, it's not showing anything. And so there's not really any risk involved when we go live here on YouTube regarding like identity and stuff like that, like someone's identity. But yeah, again, to those of y'all just joining us, we're doing our third case of the day, doing a gynecomastia. So for those of you who don't know what a gynecomastia is, what the procedure looks like, we have a male patient here. He just has some excess like fat tissue on his breastplate, and so we're going in and removing that excess tissue, that excess fat. It can be caused by, hormones, or it can be a genetic condition that leads to the excess of all of that fat, all of that tissue in males. And so we're just going in and removing it. But we are open to any questions you may have. We'll be here for a little while. This will be our last live of the day. But we'll be back here later this week, of course, for some more lives and some more cases going on later today. So tune in for those. Earlier this morning, we did a rhinoplasty on our first case, and our patient had some beautiful results that we will be posting on our social media soon, like her before and after. She had a really great result, a really great after. And so we were live for that one on all platforms, on our YouTube. So we showed the surgery. We're live here on TikTok and on Instagram. And we got some good videos and some good photos, again, of her results. So stay tuned for those.
Do you need the pedal to move it? No.
Let us switch it.
It is.
out of his breast tissue? No?
No.
Yeah, I'll take it out here for you in a minute.
Okay.
It's inside
Alexa,
the
play
little
Best
book
of
right
Journey.
Right there? Oh, what is it?
This is breast tissue.
Oh my.
Yellow and white and rubbery.
Okay.
You see it?
It's right behind you.
Yeah, I'll show you here in a minute.
Okay.
So gynecomastia is Greek. Well, gyneco means girl, or
Uh-huh.
woman. Mastia means breast.
Okay.
So gynecomastia, women's breast.
So what are
So
some
he thinks he has women's breasts. But he has breast buds.
right? So what are some reasons, or like why do some males
You can have it when you do drugs.
do
like,
drugs?
Like any kind of THC product. You can get it idiopathically, means it just comes about.
Okay.
High estrogen state. Testicular tumor.
Wow.
Puberty.
Yeah. Is it genetic? Like, can you be
If your
predisposed
dad
to
had
it?
You probably will get it.
Wow. Okay.
So like cancer dying, die, what happens next? Snarf out. I mean, you never existed. Like, do you know your grandfather's grandfather? I don't. No. Right. Somebody will forget about you, right? But you just snarf out.
Again, for those of you all just joining us, we are on our third case of the day. We are doing a gynecomastia procedure with our patient, our male patient. He just has some excess breast tissue. And like Dr. J was explaining, for those of you who heard, he's just breaking down the term gynecomastia. So gyno is woman or girl, and mastia is breast. So basically it means like girl's breast. That our patient has here. There can be many reasons why males would develop what appears to be like a female breast. It can be to you can be predisposed to it genetically. It can be caused by doing drugs, THC, and there's of course some other things as well. Like you could just your hormones could be off. You could be in a very high estrogenic state, is what he was saying as well. So there's a lot of reasons why some males will develop those breasts, those extra, what we call man boobs, basically. But our patient here today, we are just going in on those areas where there's some excess breast tissue and some excess fat, and just removing that for him. Hi, Smoky Mountain Blues. Let me read your comment really quick. Hi, I have a sharp nerve pain after a breast augmentation, only in one spot in my left one. Will it go away on its own? Great question, Smoky Mountain Blues. I would definitely go and schedule a follow-up with your doctor, whoever performed your surgery. I would definitely go and have a follow-up and see what if there's any issues. Usually, if it's a couple weeks after your procedure, of course there's going to be some pain and some uncomfortability, some discomfort after your procedure, obviously. But if it's only in one spot and it's leading you to feel concerned, I would definitely take up those concerns to your surgeon, to your doctor, have that follow-up, go seek some help. Sometimes it will go away on its own, but again, if it's something that you're really concerned about, I would go and schedule a follow-up with whoever did your surgery so they can just take a look at you. Do you have any more questions about that? Because I know like that's kind of scary. Like if it's been a few months, yeah, I would definitely go schedule that follow-up. Is it safe to leave my capsules with explant? No tissue with capsules as far as I know. Hey Becca, that is a great question actually. I am
There you
unaware.
go. Here's what it looks like.
Wow.
That white is fibrous tissue or breast tissue.
Wow. That is really neat. Let me ask on your behalf.
You hear this, Doc? Oh, yes. I've heard this story. What? I've heard this before.
Yeah, because I'm not 100% sure. But I will ask for you. Um, Give me just a moment. Is there... So I'm assuming you've had a procedure done there, Becca. That's a great question. I'll ask Dr. J here in just a moment. Yeah, Smoky Mountain Blues. Hope that helps. It started 1 week post-op. All right. Well, yeah, again, if it's bothering you or it's like really concerning you, of course, pain is normal. But if it's persistent, that's not normal. So I would definitely go and get that looked at as soon as possible. Go and schedule your follow-up if, with your practitioner, whoever did your procedure. So I'll ask that question here in just a moment, Miss Becca. But for those of y'all just joining, we are on our third case. We're doing a gynecomastia procedure today, so we're just removing some excess breast tissue and fat from our patient's breast. This is our male patient, and so again, we're just removing some of that undesired breast tissue. We're not really sure of the cause for this particular patient. It could have been predisposed genetically. It could have been drug use. It could have been a lot of different contributing factors, but currently it can happen. Again, like if your dad has it, you're more likely to develop it as well. But our patient just had a little bit of breast tissue starting to form. And so Dr. J has basically removed that breast tissue now. So we're going in and stitching where we made those incisions, where we removed that that tissue.
This is like 5 years ago. Imagine
Yeah, but again, any questions, I'd be happy to answer those. Again, Becca, I'm just waiting on, just give me one moment. Um, And again, this is our last live of the day. We were live for our first case. We did a rhinoplasty earlier. It was a beautiful, we had some beautiful results after the rhinoplasty. Our patient came in with having a little bit of a bump on the top of her nose, like up here. Went ahead and basically shaved that down a little bit, and now she has a beautiful, nice result. Stay tuned for those before and after photos. We will be posting those. We did put a little live teaser on one of our stories there on our social media. But again, like if y'all have any questions, go ahead and leave them down below. love to answer those for you while we're still live here on our platforms. And if you're interested, we're showing the surgery on YouTube today, so we have the camera flipped.
All right, we're closing up. We're good.
Okay. Again, for those of y'all who just joined us, we're finishing up today. Thank y'all for coming on and watching. Again, if y'all are ready to take the next steps in your surgery, we have a form that you can fill out here on the bottom. And once you submit it, someone from our team will reach out to you and we can provide you with more financing info, pre-op, post-op, all of the details regarding your surgery. Anyways, we'll see y'all next time. Thank you. Have a good day.
And we need a specimen cup.